Speech recovery is not just speech therapy. So this is another controversial topic because, again, the majority of people that are treating strokes will be non-physiatrists. So you have a general medicine practitioner, a neurologist, or a stroke physician who they know how to manage the vitals, the actual stroke and such events, but after that, rehabilitation is not their specialty. That being said, what do? They'll call in a paramedical to do the rest of the work. The thing is, the paramedical is a technician who doesn't see the bigger picture. So it's not to criticize them, they're trained for what they do a good job and it's very important, but you need someone who sees the bigger picture. That back to topic means speech recovery is not just speech therapy. What we see for patients is the first 3 months are the best time to make any improvement in speech. Spontaneous improvement happens in that time frame also, but a person can make gains for the first year. People with mild strokes are often conscious enough where a paramedical can work with them. So the paramedical can come in, they can do all the speech therapies with them and get them some reasonable gains before the person discharges. That's usually within a week for a mild stroke. Moderate and severe, we see a particular trend. If they can't talk, paramedicals will often tell them, wait until you can make sounds and you can work with the sounds. Now, that's not the right approach. The right approach is to get them to make the sounds and then turn the sounds into speech. And there's very particular ways we as physiatrists do that. It's both pharmacological and with technique. But waiting for something to happen doesn't make it happen. It will come in its own time. What makes it happen? People who've had a stroke will often be in a state of shock. They were normal people like you and I until this happened. And when it finally happens, now no one knows what to do or what's a priority. The family wants to communicate with this person, but they don't say anything back. They try to talk, but nothing really comes out. And they want to talk, but funny sounds come out instead, or half of a word. And the worst part is they know it. So they feel all the worse. They could do all these things normally, and now they've lost it. So there's particular techniques we use to get a person to speak after a stroke. It's not just speech therapy. And by doing these particular techniques, the person starts to gain the ability to talk. And when they gain the ability to talk, we can start working with speech therapists to refine that. Now, another thing we see is people after 1 year still getting speech therapy, and it becomes kind of a ritual. The year is over, they're not making much more gain, but the family keeps spending money on these things until they have no money left. And that would be things like physical therapy, occupational therapy, speech therapy, where these things just keep happening as a routine. The person sees no gain, but the family is doing what they think is the right thing, and nothing more happens. So the basic issue here is this: a person should have a reason to speak, and then be trained to speak from there.